Good afternoon, everyone. Let's get started with today's session. Welcome to HRPP's Research Matters. I'm Erica Salzik, the Department Administrator for UT Southwestern's Human Research Protection Program, and I'll be one of the moderators for today's session. I'm going to go over some housekeeping items really quickly. So here we go. So if you have any questions for our presenters, please type them in the Q&A. One of our moderators will respond to you during the session, or if we have time at the end of the presentation, we will address it at that time. This session is being recorded, and you can watch it again right after it's finished by clicking on the Microsoft Teams Live link in the email invitation. We'll also send you the slides via email. And you can find the links to future meetings, slides, handouts, and past recordings on HRPP's Research Matters website under the Training and Resources page. We do provide a certificate of attendance for those who have logged in using a valid email address. If you do not receive one via email but should have, please send an email to hrpp@utsouthwestern.edu to request a certificate. And lastly, we want to hear from you. We're interested to know what topics you would like us to cover during these sessions. How did our speakers do? And how our office is doing. So if you could take a few minutes to complete the survey to provide your feedback, that would be great. You may access the survey using your phone via the QR code shown on your screen here, or your computer by selecting the link. The link for the survey will be dropped in the Q&A in just a minute. Here is our agenda for today. So we have some announcements from the IRB office, which will be covered by Mayed Bird. And then we'll have a presentation from our Quality Assurance and Monitoring Office. Manali Thakur will provide information about a new initiative on guidance and oversight for FDA regulated studies with external monitoring. And then we'll hear again from Mayed on repositories, and we will conclude with an open Q&A session if we have time. So I'm going to turn it over to you, Mayed.
Thank you, Erica. Let me get my slide shared. Okay, just a quick update from an IRB standpoint. Not a lot going on, but I do want to make sure we keep you all abreast of the IRB staff updates and vacancies. So we recently, Tara Garcia was recently promoted to the full board program manager. So if you remember working with Tara, she was a full board meeting manager. She helped facilitate meetings, and so she's now been promoted to the program manager role, which will oversee full board activities and kind of looking at quality and quality assurance and quality improvement activities, making sure we've got really good SOPs in place and onboarding and training new IRB and staff members. We also have Michael Henson, who started with us on February 20th as a new regulatory analyst for the full board team. And then we have Cuthbert, who also likes to be called Ziwo, Titi Hongjo, who started with us on March 4th. So he will also be working for the full board team. So we've got 2 new regulatory analysts on the full board side. Also, with that in mind, we have just a couple of vacancies. We now have a senior regulatory analyst position on the full board team. And then we have 3 regulatory analysts positions to fill on the expedited review team. With that, I'll turn it over to Manali.
Hello?
Yes,
Thank you,
we can
Mayed.
hear you.
Okay, perfect. Thank you, Mayed. So welcome, everyone. I'm Manali Thakur, and today I'll introduce HRPP's new initiative, Remote to On-Site Visit Reviews, or as we call them, ROVERs. So this visit type ROVERs is aimed at enhancing oversight and support for studies with ongoing external monitoring. There are some key areas that we investigate. First, we focus on spotting recurring deviations, trends of non-compliance, and any documented sponsor or CRO complaints that could potentially lead to FDA audits. Another aspect is that we empower study teams by providing tools and resources. We help teams resolve issues efficiently and make their research processes more effective. In essence, I'd say rovers are about proactive support and improvement, ensuring that our studies meet the highest standards of compliance and quality. These rovers are relatively new. The first time a rover visit was conducted was in September of 2023. Since then, rovers have been conducted on 4 studies at UT Southwestern, and there are 6 more that are scheduled for the upcoming quarter. To give you an overview, so a rover begins initially with reviewing only sponsor monitoring documentation. Our monitors, the RMAs, will ask for all monitoring related documents within the past 5 years for a remote evaluation. This includes monitoring reports, action items or queries log, sponsor communications, deviation reports, and any retraining efforts from the sponsor. At this time, the RMAs will check for any patterns, any trends of non-compliance, any escalations of complaints, or maybe suspensions or holds by the sponsor to, so the purpose of the RMA is to make an assessment of concerning issues that could become a cause for reporting to FDA or a possible FDA audit in the future. After this review, if no major issues are found, the visit ends there, and the RMA will send out a final report closing out the HRPP review. However, if issues are found, the RMA will schedule an available date and time with the study team and schedule an on-site documentation review. This review will be focused on finding the root cause of the problem and meet with study team to provide CAPA guidance, give appropriate checklists or templates as needed, and may also recommend collaboration with the study teams and sponsor for a smooth study workflow. For these kinds of visits, eligible studies are those that are FDA regulated and have ongoing monitoring oversight by a sponsor or a CRO. QAM randomly selects few eligible studies per quarter for such a review, and the selection criteria, I've listed it here in the slide. So to talk about the process, starting with the remote review process, and this is for the sponsor monitoring documentation, I would say it takes about approximately 5 to 6 hours. We look at all documents within the past 5 years from the sponsor, and that is remotely accessed. We will then schedule a debriefing Teams call with the study team and talk about any issues if they're found. If nothing's found, then a final report will be sent, and that will be the end of the visit. Now, for on-site reviews, and those are if any issues are found during remote visit, they would last for approximately 5 to 6 hours as well. We do this visit to check all the study documentation and talk about the issues that we found. We provide guidance, templates, checklists, as I said earlier, and help the study teams on how to resolve issues. At the end, we provide a final report to the team and help them with CAPA on how to avoid future reoccurrence. With this, I am going to conclude this presentation by saying that rovers are a new approach for us and our processes are still evolving. We're learning and improving as we go, so any feedback you may have is valuable and welcome. Thank you.
Okay, I'm going to take things over and go to our main presentation. So good afternoon again. I'm going to be talking about how to navigate IRB approval for research repositories this afternoon. So when we think about research repositories, there's a number of terms that come to mind. You think about registries, biobanks, you think about leftover materials. Basically, they all kind of have something kind of in common, is that there's going to be some type of material that's going to be collected or used with the idea of future unknown research in mind. So the overview of our presentation today, we will be discussing what is a repository. We'll be discussing differentiating research studies from repository studies. We'll talk a little bit about the types of research studies, the applicable regulations, repository procedures and repository models, IRB considerations, which also will include protocol considerations, the benefits of establishing a repository, and then finally we'll talk a little bit about some best practices and discuss a few frequently asked questions. So first off, what is a repository? So a repository is a system or facility that collects, stores, and distributes data or biological specimens or samples that are obtained from living individuals for research use. The research use is facilitated through repositories establish plans for sharing the information or the specimens, either with repository investigators who collected the data or samples, or with other investigators. Like I say, these could be internal, these could be external. Repository activities typically include three components. The first includes collection. So this is going to be the collection of data. This will be the collection of samples. The second component is storage. So this is the storage and maintenance of the information or specimens that are contained in the repository. And then finally, we have the distribution. So this is, again, the plans to distribute or share the specimens or the data that were collected for the repository. In discussing what a research study is versus what a repository is, one of the first things we want to talk about is the regulations, obviously. Sorry, my earpiece fell out. Obviously, with research, we have the federal regulations that we have to take into consideration, the 45 CFR 46, 21 CFR 50 and 56. With research studies, there's a research question to be answered, or there's an experiment. There's something that needs to be tested. Research studies typically have an end date. So once endpoints have been met, or you've established maximum tolerated dose or dose limiting toxicities, you basically have an end to a research studies. Research studies can also collect and store information. And in regards to a consent form, you have standard consent elements, or in certain situations, you may be able to waive informed consent. A repository, on the other hand, they do also take into consideration federal regulations, but typically with a repository, there's no research question to answer. The purpose pretty much of a repository is to bank information for some future research that has not occurred yet. Repositories are typically meant to last forever. They really don't have an end date because you can collect as much as you can and plan to do future research activities. As I mentioned before, repository collects, stores, and can distribute data. With regard to the informed consent on repositories, there are some additional elements of a consent that are required. And in some very rare situations, the IRB may waive informed consent. So now let's talk a little bit about the types of repositories. So first up, we've got data repositories, data banks, or data registries. So again, this is a situation where you're just collecting data. This could be data collected from medical records, from clinical purposes. It could be data that's collected on behalf of another research study, and there's plans to deposit information in a research repository. Data registries are typically the same thing. They're usually kind of an accounting of a certain kind of disease, and it's aimed to be compiled with other information or similar information, and that would be considered a data registry. Specimens typically are going to be like a biorepository or a biobank or a specimen bank. So typically with specimens, You can have a bank of specimens where there's planned to do future research with it. But typically when we have specimens involved, it's usually a combination of data and specimens where it includes, the specimens that were collected and information about whom those specimens come from, like conditions and services and procedures and so on and so forth. So switching gears to talk about applicable regulations. First off, we deal with the OHARP regulation. I mentioned this before. This is the 45 CFR 46. When we're thinking about research repositories, we have to think about those questions on whether it meets the criteria for research. And we go on to define research as a systematic investigation, which is including development, testing, or evaluation designed to contribute to generalizable knowledge. So systematic investigation refers to the careful or detailed inquiry or examination of information that involves a system, a method, or a plan. Whereas generalizable knowledge is information or something that's widely applicable. So in the realm of research repositories, there's this goal of creating this bank of information or specimens because ultimately it's going to contribute to generalizable knowledge by being used for future research questions or future research studies. When we think about whether human subjects and whether they're involved, OHARP goes on to define a human subject as a living individual about whom an investigator, whether it's professional or student, is conducting research, obtains the information or biospecimens through interaction or intervention with the individual, and uses, studies, or analyzes the information or biospecimens. Or the other option is obtain, uses, studies, analyzes, or generates identifiable private information or identifiable biospecimen. That word is missing from the slide. But ultimately, in this situation, living individuals or living subjects, a repository meets that definition because typically the information is coming from living individuals, and there's plans to bank it, and there's plans to pull from the bank of information and use it for future unknown research. Switching gears to talk about applicable regulations according to the FDA. I've mentioned those before. So that's 21 CFR 50 for informed consent, and 21 CFR Part 56 for IRB review. So with the FDA is really concerned about clinical investigations or clinical trials. So if there are plans to conduct a clinical trial and you involve a human who participates in the research either as a recipient of a FDA regulated test article as a control, typically the FDA regulations are applicable. In another situation, it's a subject is an individual on whom or whose specimen is going to be used where you're using an investigational test article. So in those situations, that's when we would say that the FDA regulations should be considered with regard to research repositories. It's rare for them to happen at the level of establishing the research repository, but I have seen some repositories employ some like assay or some type of thing where they want to bank the results of that assay and then keep it for future unknown research. And then finally, we'll talk a little bit about the HIPAA regulations. So HIPAA is when HIPAA is applicable when there are plans to use or disclose protected health information to create the research repository. In these situations, this is information that could come from informed consent / HIPAA authorization of the participant, or where the IRB waives the requirement to obtain HIPAA authorization. The other situation is going to be subsequent use or disclosure of the protected health information or the data in the database for a particular research protocol. So this is referring to the distribution or the sharing of materials from the research repository. And I always like to say that it really kind of depends on what type of information is being requested out of the repository to determine whether, HIPAA waiver or HIPAA authorization is going to be required. Authorization is typically not required for subsequent use if you're planning to disclose de-identified data or a limited data set where the IRB has waived the HIPAA requirements to use subsequent identifiable information. So there, like I say, it just kind of depends, and I'll go into a couple of scenarios a little bit later. Some other regulations and protections that should be taken into consideration is the Genetic Information Non-Discrimination Act, which is also referred to GINA. This particular regulation protects individuals against discrimination based on their genetic information in health coverage and in employment. So there's typically language that we can include in the informed consent document. And what this particular act does is it prohibits the use and disclosure of the genetic information that's covered by health plans for underwriting purposes, which includes eligibility determination, premium computation, applications of pre-existing conditions, exclusions, or pretty much any other activity to the creation, renewal, or replacement of a contract health insurance or health benefits. As I mentioned before, we've got the GINA language embedded in our informed consent template. Another protection that's offered is by the certificates of confidentiality. This is kind of like a protection that's obtained from the NIH, and it's typically granted automatically for any federally funded research. And this particular protection, it protects the privacy of the research participants by prohibiting disclosure of identifiable sensitive information to anyone that's not connected with the context of the research, unless the participant volunteers that information or provides consent to provide that and share that information. Certificates of confidentiality can be obtained if your research repository activities are not covered by federal funds. They can be obtained. So talking a little bit about repository procedures or activities, let's talk a little bit about the collection. So collection can occur in a number of ways. You could have an investigator that seeks to collect information, existing or prospective clinical information. So this is information, or this is specimens. This is something that already exists for the purposes of clinical care. So these could be leftover specimens. This is data collected from medical records. It could be images. The IRB considerations for this particular category are pretty much the same for all research. You could also establish the collection activities under a repository to include existing or prospective identifiable research materials. So this is going to be materials that come from other research studies. And in a situation, informed consent should either be listed in the main studies consent form, or you could potentially have a standalone research repository consent form that where you would actually obtain consent for the main study and this repository. It should, if it's contained, if the option to participate in the repository is contained in the main studies consent form, it should be optional. The next we have is prospective collection for the repositories. Now this speaks specifically to the repository. This is only procedures that are occurring because I want to bank them. So this could be like the collection of additional specimens, maybe during the standard of care procedure. For example, you could potentially have a fine needle biopsy, and where for the purposes of standard of care, this is being done to determine or stage cancer. But for the purposes of the repository, you could have an extra pass, fine needle pass, and that particular specimen would be for only the repository. You could have questionnaires, you could have anything, bloods, saliva samples, you can pretty much collect anything, stool samples. But again, the purpose with prospective collection for the repository is that this is a repository only procedure. For this particular situation, again, you want to make sure that you have maybe a standalone informed consent document, because it really is going to speak to the procedures that are going to occur for the purposes of the repository. And then you could have de-identified collection of data. So this could be public information that gets pulled into the repository, clinical, it could be research materials. It's basically any information or specimen that are left over that you would not be able to readily ascertain the identities of the individuals. In that situation, informed consent is not going to be required. When we talk about storage, storage can come in the sense of an external repository or an internal or local repository. So an external repository means that the repository itself, the housing of materials, the housing of data is stored offsite to a non-UT Southwestern or affiliate location. Whereas with a local repository, that would be materials, data that is stored either at UT Southwestern or one of our affiliate sites. So there's kind of a little bit of a difference, and it's important to know from an IRB standpoint where the information or the materials will be stored, and I'll get into that a little bit later. Now for the fun part, the distribution activities. So when you're talking about research repositories, de-identified data to non-repository staff, in that situation, because when you distribute non-identifying information or de-identified data, meaning it's stripped of all identifiers, there's no dates, there's nothing like that. There's just like conditions. There might be age as long as it's below 89, or they're grouped as below 89. It could be types of procedures, but no dates or anything like that. In that situation, when the repository plans to distribute that information, IRB approval is not required. The recipient investigator is what we'll call the other person receiving materials from the repository. The recipient investigator may obtain existing repository data or specimens, or they could obtain new information if it was collected by the repository staff. Just be sure that if there are plans to distribute in this manner, that modification to the main protocol would occur to include any additional data points that would be collected. Now, it's not required, but the best practice is for the recipient investigator to obtain a non-human determination from the IRB. This is just kind of a safe fail. It protects the PI who oversees the research repository, and it also protects the recipient investigator. And as long as you have that in place, you've got rules in place of the repository that won't allow the distribution of identifiable information. So next we have de-identified data distribution to repository staff. So these are going to be, so the first scenario are going to be individuals that are not on the research study. And whereas the second scenario is going to be distribution to individuals that are on the study. Maybe they're collector investigators, maybe they see patients in their own clinic and they collect and distribute, or not distribute, store information in the repository. In this situation, as long as you've got some type of process to recode or de-identify the materials, IRB approval is not required. In this situation, you may only obtain existing repository data, no new data, only because it's going to be, you basically have to run the query over again, so to speak. The best practice for this recipient investigator, even though they're repository staff, is to obtain a non-human determination or have some type of mechanism in place. We'll talk a little bit more about that later, to assure that information that's going to be secondary use from the repository is sent in a de-identify or totally recoded where you can't link that code back to the original data set or the materials. And then finally, we have identifiable data distribution. So in this situation, IRB approval or an IRB determination will be required. So in the sense of where you're doing exempt data, you could have a recipient investigator do exempt activities. For example, they could receive identifiable information where the recipient investigator has gone through the IRB and obtained an exempt determination on its own. And another situation where it might be expedited, and this could be a situation where maybe the data is not, HIPAA is not applicable to the data. So the carve out with exempt research is category 4.3, where it's normal information covered by HIPAA, but in some situation, data is not covered by HIPAA. It could be student information, student record information, and that's not covered by HIPAA. So in that situation, if you're working with identifiable data or recipient investigators collecting identifiable information from the repository, they would actually have to get an expedited review determination. Also, if you're working with specimens and you plan to collect identifiable specimens from the repository, that's also something that's not covered by HIPAA. So those would be submissions that the recipient investigator would need to get their own IRB expedited determination on. In those situations, the recipient investigator has to deal with consent, waivers of consent and authorization. They also have to address whether recontact can happen. Obviously, this is going to be a situation where the main repository allowed reconsent to happen. And then the purpose of the recipient investigators research really should be kind of in lines with the reason that the repository was established. And then in this situation, the PI that oversees the research repository should have, I shouldn't say should, it must have a process in place to track and the disposition of the data and or specimens. So that's kind of a loaded, but like I say, that's the fun part of repositories. So when we talk about repository models, these are just really talking about the types of collection activities based on, local PI, where you could have, maybe I'm a lead PI or maybe another PI is a lead PI. So with a local repository, the PI collects the information, they can store the information, and they can distribute. So I don't know what good is a repository if you don't have plans to distribute, but I have seen some investigators that just want to create repositories and just collect the information and store. Again, those were later determined to be activities that they wanted to distribute to make use of that information that was being collected. You could have a central repository with the local PI as the lead. So this is a situation where a UT Southwestern or an affiliate PI is the lead PI of the repository study, and perhaps they collaborate with institutions external to UT Southwestern. This could be a SIRB or single IRB review situation where UT Southwestern can be the reviewing IRB for those external sites. The local PI will obviously be collecting and storing the information, but those satellite sites could just be collector investigators, is what we call them, where they're just really collecting the information to share with the local PI. And there's some benefits to that, obviously, is those collector investigators may be able to have access to this broad data that, that's coming from different places around the world, around, the United States, so on and so forth. So that might be a benefit of that. And then having a central repository where maybe UT Southwestern or our affiliate is not the lead site. And in this situation, it could be where we rely on an external IRB, or we can also be the reviewing IRB, obviously, if it's not federally funded. So in this situation, our PI or the UT Southwestern affiliate PI is the collector investigator, where we're just collecting the information. Maybe we're obtaining informed consent, and then we're depositing that information into an external repository. In that situation, our local PI or local or affiliate PI would not be able to store the information. It may be a copy of what was sent off to the external repository, and our local PI would not be tasked with or the ability to distribute and share the information with internal users or external users, because the lead PI would have the distribution activities covered under the main repository. Talking a little bit about the informed consent, as I mentioned before, there are some additional requirements with regard to research repository informed consent documents. Obviously, we want to make sure that the informed consent document describes the location or the operation location of the repository. We want to be sure that the consent form talks about the types of research that are going to be conducted with the materials in the future. So in general, like if you have specimens that are collected from cancer, so typically you're going to have recipient investigators do research where it's cancer related. You're not going to have like maybe an orthopedist come in and look for bone fragments from bone cancer for an orthopedic, procedure. You want to make sure that there are, in the informed consent document, that there are conditions in which the data or specimen will be released to investigator or recipient investigators. So are those going to be only distributed to recipient investigators in a de-identified manner, or are these going to be identifiable? And then kind of what protections are in place. So if you're distributing, if there are plans to distribute information in an identifiable manner, you want to make sure those that the subjects are aware that they're going to have to obtain IRB approval, where research regulatory oversight for their activities are going to be covered. And then additionally, you want to make sure that you don't release that information until that recipient investigator shows proof of IRB approved activities. So that's an important component. And you also want to make sure that there are procedures for protecting privacy of subjects and maintaining confidentiality of data. Wherever there are plans to do any type of genetic research, we want to make sure you obviously include the risk of genetic research, which is a typical component of a consent form for biorepositories or biobanks. Our UT Southwestern Form ER repository consent form actually addresses all of these components. So as long as you're using our UT Southwestern consent form template, you should be able to incorporate all of these required elements. We talked about GINA earlier. That could also be something that you include in your informed consent. Again, our template includes that. And obviously, if you get a certificate of confidentiality, that's an additional component or an additional level of protection that is offered to research participants that you may include in the informed consent document. Now, talking about waivers of consent, HIPAA waiver, it's a sensitive topic because, who wants to, as an IRB, waive consent if you're going to collect information from records, or if you're going to, make copies of anything and you're not going to go get informed consent. So it's a sensitive topic. We don't want to apply waivers of consent, HIPAA waivers, just haphazardly. We want to make sure that we're taking into consideration our policy requirements. So obviously, from a regulatory standpoint, there are criteria that have to be met in order for a waiver of consent to be approved, and same for a HIPAA waiver. It's got to be minimal risk, cannot negatively impact the rights, welfare, or safety. The study or the research repository has to be impracticable to carry out if you have to go back and get informed consent. Like, there's no way to carry out your repository without the identifiable information, so on and so forth. So those criteria have to be met. And in addition to those, we've got some more institutional criteria that have to be met. So that the protocol includes a plan for allowing subjects to opt out of the repository or certain aspects of the repository. So this is not a regulatory component, this is an institutional policy. And thinking about materials that are going to be collected and included in the repository, it has to be materials that have been collected for non-research or, for other research purposes. So in a situation where, you've got repository only procedures, we can't waive informed consent for those. It only has to be a situation where you're making a copy of what exists clinically or from another research study. Okay, so those are going to be the situations where the IRB can apply a waiver of consent. Like I say, it's sensitive. We're going to give a lot of scrutiny to those types of studies because, again, think about what you're asking the IRB to do. Is you're basically asking the IRB to violate human subject rights, which is what we're doing with the waiver of consent and a HIPAA waiver, violate those rights for the purposes of research. So again, we want to be very sensitive to what we're asking and, giving a really good reason and making sure that there's good documentation in place for a request of waiver of consent or a HIPAA waiver. The other component that I probably didn't include on my slides, but it could also be an option, is waiving documentation of informed consent. And in that situation, the requirements in terms of the regulatory requirements are a little different. It's for a waiver of consent, you have to talk about how it's minimal risk, and then why is it that you're not getting informed consent? You could provide subjects with an information sheet. But you still have to assess and deal with HIPAA. Do you waive HIPAA altogether, or do you alter the requirements of HIPAA to maybe omit the signature section and still include all the required elements of consent and all the required elements of HIPAA in an information sheet? So I didn't include that on the slide, and I'll probably go back and do that just so that you have this to refer back to. But yes, that could also be an option for research repositories. In consideration for protocol details, you want to make sure that you have a background and objective of the research. So your background is, why do I need to create this repository? Your objectives of the repository is, what are you trying to do? Why do you need to bank this information? We want to also make sure that you include design. So how is it that you're planning to get the information and store it into the repository? And you want to describe any anticipated benefits. So obviously, anticipated benefits is, I don't have to go out and carry out another study and subject people to another research study if I have a bank of information where it collected information or specimens from already occurring procedures. You'll want to talk about your populations to be included. Obviously, you're going to have maybe these are research study participants, so that would be a population in and of itself. So it'll be participants of this study. You could have generic populations also, for example, children. I want to collect information from here. It could be anything, but you want to make sure that you address your populations. And if this is like a big repository where you're doing some of the clinical materials and some coming from research studies, then you want to address all of your populations. You'll want to talk about your recruitment methods. So again, along the same lines of, if this is just kind of a single repository where I'm just collecting, clinical information, maybe the IRB's issued a waiver of consent, there's no recruitment methods. But if I'm collecting specifically for the repository, meaning I'm only doing the procedure for the purposes of the repository, or if I'm going to ask that study participants of other research studies allow me to make a copy of their information and place it into this repository, you'll have to talk about how you plan to recruit those individuals into the repository itself. The location of the repository, this is important because sometimes locations change, right? So we want to make sure that you include the initial location. People have the right to know where their information is stored. And if it ever changes, as I mentioned before, you need to make sure that they know where their information is now being stored. The repository activities. So again, this is kind of referring to what I'm going to be doing. So I'm just making a copy of clinical materials? Am I making a copy of what was collected for that other research study? Or do I actually have research repository procedures where I'm carrying out a whole set of procedures specifically to this repository? We want to talk and address informed consent, HIPAA waivers, or authorization. So this kind of, again, refers to repositories being this big, large entity where it can be a conglomerate of a lot of different activities. So you'll want to address informed consent, waivers of informed consent, HIPAA authorization, waivers of HIPAA for all of those populations. Because again, this can grow to be such a large repository or bank of information or specimens or materials. You want to plan to monitor subject safety. So obviously, typically things that come up with repositories is sharing of information. That's the biggest issue that I see is sharing of information. Oh, I shared identifiable information and I wasn't supposed to. It's typically with distribution of activities. Sometimes we have situations come up where locations change or PIs change and there's no plan to inform the subjects that has changed. But again, subjects have a right to know that information. So we want to make sure that you have a plan to monitor subject safety. We want to make sure that there's a plan in place to manage the materials. So where are these going to be stored? How are they going to be stored? Who has access to the information? That is a plan that should be included in your repository. Recontact for future. So you can have a component in place where you ask participants of the research repository whether they could be contacted for future unknown research or whether they decline that, and how do you plan to store that, and how do you plan to flag that record as somebody that either wants to be contacted or not. So you want to make sure that that is described in your protocol. And again, this is an IRB consideration. You want to talk about repository results. Are they going to be returned to the subjects? What about clinically relevant research results? Like those are types of things that that need to be addressed in your protocol. And then obviously the big one, which is the plans for distribution. You want to talk about who gets access to the materials, how they get access to the materials, who has priority. And then, if you're managing kind of like a robust electronic system, how do you manage recipient access? It's all of those components that need to be included in your protocol because those are components that as an IRB, we're going to need to consider in terms of regulatory criteria that are being met, privacy and confidentiality. And then obviously you want to make sure that there are plans to track the disposition of materials from the repository. Who obtained access, or what did you give these recipient investigators? How much was given to the recipient investigators? You want to make sure you track that, because at the time of continuing review, that is something that we ask you about. So talking a little bit about some benefits of repositories. So this allows for investigators to collect data or specimen once. So it minimizes risk exposure, it protects participants. You can use the materials for many studies and answer many research questions. So this is kind of like a good stewardship of your the research materials. It also encourages collaboration. I can also talk to you about some negative things, but I'll just talk about the benefits today. But the broad focus of keeping materials for a long time, so you can complete studies quickly, because there's not a large IRB review and approval process, and the materials come from one central location, meaning you don't have to go out and collect them yourself. You can use the results to collect information or specimens from repositories so that you can prepare for funding or grants. So it'll help you kind of carry out some of those preliminary studies. Some of these research activities or subsequent research activities that occur out of a repository can essentially be non-human. Again, it minimizes risk to participants, and you don't have to have IRB approval. You don't have to carry out your study. You don't have to have money to do it. And then, of course, this helps compliance with funding mandates. So, for example, with the NIH data sharing plans or data sharing requirements, this will also make sure that you've got plans in place to address those. I'm going to talk a little bit about best practices. So establishing an honest broker, I'll define honest broker kind of in the next slide, but establishing an honest broker is a really good practice to have. The role of an honest broker really would be, to maintain those materials that are in your repository, maybe receive requests from recipient investigators, and then actually be the individual who de-identifies or distributes the information based on the IRB approved repository distribution plan. You want to make sure that you've got a really good stewardship planning process in place. So again, this is talking about who gets access to the repository materials. How do they get access? Who receives priority? Who's not going to get this information? Will we require data use agreements? So on and so forth. Another best practice is to offer the ability for research subjects to opt out or withdraw from the repository. Obviously, they maybe up until the point of their withdrawal, you're able to use their materials, but at the point of withdrawal, you're no longer able to use their materials in an identifiable way. What you do is just de-identify the information, but you keep that specimen or that data in the repository, just de-identify it. You want to make sure, like I say, you keep participants that participated in the repository informed about changes to the repository. For example, if you have location or PI changes. Location and PI changes, they don't have to be a whole nother informed consent document that you have to go back and reconsent everybody on. It could be when you have a change to the repository location or PI, you could tell the IRB, well, I plan to notify previously enrolled participants of this change via letter or memo. So you don't have to go back and reconsent them, especially if this is like a one-time visit or you're not going to see these participants anymore. It can be a letter or something like that, so that way they are informed. Another best practice is talking about incidental findings and how they should be communicated. I addressed this particular topic in the Research Matters from October of last year, so I'm not going to regurgitate any of that information other than just making sure you're considering what information is it something that they'll be able to act on. Think about those things when you're trying to communicate incidental findings to the research participants of a repository. And then obviously you want to maintain records for distribution activities. Talking a little bit about an honest broker. What is an honest broker? So this person or this individual acts as an intermediary between researchers and the data subjects. They ensure that the researchers don't have access to any of the identifying information, so they potentially help protect the privacy and confidentiality of the information that's held in the repository. So they basically can help by providing only de-identified data or specimens to recipient investigators. So they help maintain integrity of the data set, and it also helps reduce unintended disclosure or misuse of sensitive information. With an honest broker, managing data access and sharing, researchers can collaborate kind of more effectively across institutions, research projects. The broker can basically streamline the process to ensure compliance with regulations and policies. And finally, data received through honest broker is typically de-identified. Obviously, there is an identifiable way, but it makes the research activities of the recipient investigator non-human in nature. So with that in mind, I'm going to go over to some frequently asked questions. So I've seen this question come up. Is a repository study, is this a repository study if a sponsor has language about future use related to the drug or device being tested? So this is a situation where you could potentially have a sponsor's embedded repository, but the language in the consent form says, well, we're only going to be using it for further testing of this drug or device that we're using or testing now. In this situation, the answer is no. Sponsors may want to test specimens and do additional analysis on the same product. So the storage of the materials for this type of testing doesn't make the activity a research repository activity. So next we have, can research consent form include repository language if materials are being copied into a repository? I think I addressed this earlier. So yes, you could have a standalone consent form for the repository, or you can actually embed repository language for the repository study embedded in the main study or research studies consent form. Obviously, if you do it that way, you want to make sure you have an opt-in, opt-out. Again, you can have a separate consent form as well. How are SIRB repository studies reviewed? I'd say the same. They're reviewed similar to how we review normal research studies. So typically a reliance request is submitted depending on who the IRB of record is. We'll acknowledge once we get documentation of reliance in place, then we'll allow you to submit. So again, it's the same as a research study. Are there special forms that I need to include with the repository submission? So yes, typically the Form A, the Form A1 is the supplemental repository form. That just helps us understand what your collection activities are, where the information is going to be stored. It addresses what your distribution plan is, but you want to make sure you also include a protocol, because that's the meat and potatoes of here's what I'm studying, or here's what I'm gathering information for. Here's the methods that I'm going to be used. Here's the procedures. We still need all of those components. So Form A and Form A1. Also, the supplemental repository form is something that we often miss at the time of continuing review. So you want to make sure you include that at the time of continuing review. Next is, what if my department has a clinical database and I have a study that I'd like to conduct by using the available data in the clinical database? So in this situation, I always refer to my favorite phrase, it depends. So it depends on what information is being stored in the clinical database. So if the clinical database, which can be established for a department for quality and improvement, quality assurance and improvement activities, if the information that you have to go through as a researcher has private identifiable information or protected health information in there, you going into that clinical database means that you're engaged in exempt research. So you have to get exempt determination. Now, if there's information that you store from a clinical standpoint for quality assurance and quality improvement, and there's no identifying information in there, that's basically non-human research. You can submit a non-human request from the IRB and to get a determination of non-human. What is the difference between a clinical database and a research repository? A clinical database, their use of a variety of health information or electronic health information that are being used to diagnose, treat, bill, market, or to improve quality. Again, so you're using the information, or it's banked because I want to look at things, I want to improve things, I want to just like I say, take a glance at what's going on in the department. Whereas research repositories are banks of materials that are being done or collected for the purpose of, or the sole purpose of, I want to be able to answer research questions in the future without having to go through a long protocol, draft price process, IRB approval process, recruitment, and so on and so forth. So again, the goal of a repository is to bank materials for future unknown research, whereas a clinical database is for quality improvement assurance. That is all that I have for research repositories today, and I'm opening the floor to questions.
Yes, thank you, Maya. Yeah, we'll pause for a few moments, just to see if you do have any questions and to get Maya ready to answer those questions.
Okay, I see one question in the chat right now. Is there a difference in a registry and a repository? They're pretty much the same thing. A registry typically is just data that goes into a bank of information. Repository is like all of the activities. It can be data, it can be specimen, it can be both. So it's just kind of another term for repository, but it typically refers to just mostly data that's going into a repository. Okay. The next question, it says the NIH DMS policy plan includes describing a description of repositories where scientific data and metadata arising from the project will be archived. Are there any local data repositories at UT Southwestern that researchers can use? I don't know if there's one at this time. I know there's talks of one, but I know that I don't know right now. So I can actually get back to this question later because I've heard talk of one.
Okay.
The second part of this question is, can IRB provide guidance on best practice for how to deposit in our data? So I think, as I mentioned before, let me find out if there's a central repository for the institution. I don't think that there is, but I know that there have been talks about it. And then I can establish some best practices for depositing data there. We do have a tip sheet available on our website that helps talk or incorporate your data sharing plans. So I would consult with that as well. Maybe we can drop a link into this particular question that can refer you to that. But I would like to kind of offline address this question.
May I add just real quick also, we do have a policy and procedure chapter. It's 2.9. So maybe we can also provide that.
Yes, thank you, Eric. Any other questions?
No, at this time, I don't see anything else coming in.
We've got a couple of minutes. We'll just give it maybe a few more seconds before we give it up.
Yep.
So we've got another question. Does the consent form for the repository need to be uploaded in Epic? Yes, so research consent forms do need to be uploaded into Epic. The next one is, if a researcher is requesting materials from our repository, do they need to name our repository as a specimen source in their protocol? If we were the reviewing IRB, I would say yes, because we want to be able to go and look at that repository and confirm that that particular repository is approved to distribute and the way that you plan to get materials from that repository. So if, for example, if you're getting identifiable information and that repository was not approved to distribute identifiable information, that wouldn't be something we allow for the main repository. So yeah, we would want to know. But then if it's an external recipient of the information, the recipient has to check with their IRB. But I know if we were the reviewing IRB, we would want to know the source of the materials, again, because we want to look at repository rules. We want to look at all of those things to make sure that the investigator who collected all the materials is approved to distribute. Yes. Can we have access to the recording? Yes, you will have access to the recording after it is complete. And in regards to the slide, I need to make 2 updates to the slides. I want to make one of them so we can see all the wording on it. And then another one, I would like to include the waiver of documentation information on the slide that I discussed verbally but didn't put on a slide. So I'm going to make that change, and so that give me one day to get those slides updated.
Okay. Okay. I think I'm going to wrap it up. So this does conclude our presentations for the session, and I want to thank our presenters, Mayed and Manali. I want to thank you all for attending today's session. The next Research Matters session is scheduled for April 16th, so have a great rest of your week.